at the beginning, we really were the sole voice with regard to patient safety. That meant that we actually began the rallying cry that really focused on improving patient care for folks in the healthcare system.
When NPSF was first created, it was really about raising awareness and just even highlighting the fact that patient safety is a major issue, because back 20 years ago, people weren't even talking about patient safety.
The National Patient Safety Foundation has made a tremendous contribution in bringing lots of different perspectives to the table to have meaningful discussions about patient safety. They've brought providers, policymakers, and most importantly, patients and family members together to talk about the issues, to talk about the solutions, and to work together to find those solutions.
The status quo is just not acceptable. And from changes that began back in 40 years ago to 20 years ago, we've begun to understand how important it is for us to learn from what goes on in medicine, to study those cases where things have not achieved our intended outcome, and then to take those learnings and put them back into day-to-day practice.
The challenges in patient safety are so complex that we need the best thinking of everybody in order to move this forward. I think the National Patient Safety Foundation is well recognized today as the place to go for patient safety resources, but it's also a place to go to share ideas with like-minded individuals, people who share the same challenges that any of us share, and finding new innovative solutions and approaches.
With the creation of the NPSF Lucian Leap Institute, NPSF really became a think tank and sort of a leader in setting longer-term strategic direction for where the patient safety movement needs to go.
Some people are really impatient because they think enough has not been done since the Institute of Medicine report in 1999. I have a longer view. I know things are just so much better because if we hadn't been doing anything, so many more people would be dying. What NPSF has done is move the field forward.
NPSF was started by people who had experiences, and it wasn't about us or them anymore. It was about we're all in this together. To me, that's the history of the National Patient Safety Foundation, is we're all in this together. We have to be talking about it.
I don't think we can solve patient safety in the next 20 years. It's a very complex problem. But I'd like to see NPSF really be the accelerator to continue to drive some of the changes we've already been working on, and continue to be at the forefront of all of that.
The National Patient Safety Foundation has played a very important role in organizing all of the stakeholders in patient safety to come out with a singular voice on what we need to do to move forward, but that's just the beginning. The real question is going to be, how do we actually start to leverage those early structures and really get them woven into what we do every day in healthcare? That's the work ahead of us. And I don't think that that's work that the National Patient Safety Foundation can do alone.